want to thank everybody for coming. We're just overwhelmed with the turnout and so happy to have all of you here. We're very excited to be one of the first health departments in the nation and the first in Wisconsin to receive our accreditation, and launching our award during Public Health Week seemed very appropriate, so we're very happy you all came. I'm going to turn it over to Mayor Devine to do some introductions, and then we have a couple other speakers, and I'll close with a few words.
Well, good afternoon, everybody. It's great to be here today, especially under these circumstances. Who's going to introduce? Oh, there he is. I want to introduce Alderman May, who's here from the city, as well as State Senator Leah Vukmir. And where did Ron go? The village president of West Milwaukee, Ron Hayward, is here also. And I want to also thank the members from the Board of Health, as well as the other city departments. Our chiefs are here, and everybody for coming out today. I had a lot of notes I scribbled here together, but as I look around the room, these boards here are really indicative of a lot of the services that the department provides. When you look at our community garden initiative, when you look at our work on asthma, when you look at our emergency preparedness, and all the things that this department provides, as well as running the best farmers market in southeastern Wisconsin on top of that, which goes into the healthy eating promotions that we do in this department as well. So I'm just going to totally blow my notes off here. It's really a tough road to accreditation, and this started some time ago. And we know not long ago we were sitting in a room with members of the Board of Health. We were talking with the interrogators, if we will. And they were asking us questions, and we were fielding answers, and they were very fair but tough. And I think that we achieved this level of accreditation as a big stepping stone. It's a phenomenal accomplishment, and I'm very proud to stand here today as mayor of the city and congratulate Sally and everybody here who was involved in this process. We have a lot to be proud of, so congratulations. I now want to introduce my alderman from the 5th District and also the chair of our Board of Health, Alderman Rosalie Reinke.
Thank you, Dan. If our mayor can have notes, I guess I can have notes as well. Hopefully, you won't mind. What a glorious day this is today for West Allis and for the health department itself. We're so very pleased. We're so very happy on this special occasion. And on behalf of the Board of Health, I'm pleased and proud to offer our congratulations to our health department on their National Accreditation Award. I'd like to also acknowledge our Board of Health members. I see a number in the audience, and if they would please stand and be recognized, I'd certainly appreciate it, because we have all our value going on this year. They're a group of fine people, and certainly we're very proud of them as well. Our thanks to Health Commissioner Sally Nusslock, and before her, Terry Brandenburg, who led the way on this journey towards professional excellence. However, it's the collective group of dedicated individuals who were the movers and the shakers of this accomplishment as well. The ultimate goal is to protect and promote the health of our community. So we use our resources and also our staff, and I commend all those who participated in this venture. This process is not for faint of heart. Those who were involved know how difficult it was. At many hours of time were spent in this rigorous assessment and documentation necessary to ensure the standards of accreditation were met. This is the tool needed by all health departments to demonstrate accountability and stability, provide a framework for priorities, improve staff morale, share feedback to other departments, health departments as well, and continue to improve the quality of our services. Previous to making this application for accreditation, the Board of Health participated in exercises. These exercises were to determine our strengths and weaknesses, and I'm sure many of you have done the same thing in your departments. The process consisted of holding up different colored paddles according to the answers that we chose to different various questions that were posed to us regarding our workings and our achievements. And after we would do this exercise, we would set goals if we needed to accomplish the necessary standards. So on this momentous occasion, I will hold up the last paddle and proudly proclaim that we have met the standards of the National Public Health Accreditation, and we are the awesome #1 in the entire state of Wisconsin to achieve this honor. And I have to congratulate all of the people that were involved because we're so very proud of you. Thank you. And now, I'd like to call on Sally. We have a special duty, the two of us. I'd like to call up my committee, but then they cover up the whole thing. So they'll understand. So
Rosalie's going to have the honor to unveil our plaque, which only like 3 of us in the building have seen until now. So we had it well hidden. So Rosalie,
I haven't even seen it. And all of you can take a peek when you come around after the refreshments. And now it's my distinct honor and privilege to introduce somebody very special from the state, Karen McKeown. She's Administrator, Division of Health, Wisconsin, Department of Health Services. So Karen, please come.
Thank you all for having me here. It's such an honor to participate in this celebration, and I'm just thrilled and delighted to recognize you for this extraordinary accomplishment. It's especially fitting that we're celebrating during Public Health Week. And early in the development of national accreditation, the public health leadership and West Allis leaders had the foresight to understand that meeting high standards and having consistent measures in public health was the right direction to assure health and safety of its citizens and community. And West Allis has shown leadership by meeting and in many cases exceeding accreditation standards and measures of excellence in attaining accreditation. And we are just so thrilled and so happy to have a health department from Wisconsin be in the very first group of accredited health departments nationwide, one of 11 nationwide. So I actually have a proclamation here from Governor Walker. Whereas the West Allis Health Department is the first health department in Wisconsin and is among the first 11 agencies in the nation to be accredited by the National Public Health Accreditation Board. And whereas local health departments are only accredited when their services and performance meet a rigorous set of national standards that foster efficiency and effectiveness and promote continuous quality improvement. And whereas the West Allis Health Department has been recognized as a leader in improving and protecting the health of its residents and the diverse communities and neighborhoods where they live, and grow, work, learn, and play. Whereas the West Allis Health Department has provided leadership in the development of the statewide goals contained in Healthiest Wisconsin 2020 to improve health across the lifespan, eliminate health disparities, and achieve health equity. And whereas the West Allis Health Department has been tireless in providing collaborative community leadership with its numerous partners to prevent injury, illness, and the spread of disease, to create healthy and safe environments, and to protect against environmental hazards, to promote healthy behaviors and mental health, to respond to disasters and assist communities in recovery, and to promote accessible, high-quality health services. And whereas accreditation reflects meaningful partnerships with a diverse array of state and local stakeholders, including businesses, education, communities of faith, tribes, and advocates, now therefore I, Scott Walker, Governor of the State of Wisconsin, do hereby proclaim Tuesday, April 2nd, 2013, as West Allis Public Health Day throughout the state of Wisconsin, and I commend this observance to all of our citizens.
As I said before, we're all overwhelmed by the turnout and the support we've gotten. Special thank you to our Board of Health. We wouldn't have started on this road or continued on without your support and encouragement. All of our staff have been awesome in getting all the required documentation and jumping through all the hoops we needed to do to achieve all of the measures. There's actually 97 measures that we had to submit evidence for. It's appropriate that we do this during Public Health Week, because Public Health Week is return on investment, and I think we can actually see all of the time and effort that we invested in this process has come to fruition, and we are now recognized nationally as one of the top health departments in the nation, and it shows to everybody that we do meet a standard of care and accountability for all the things that we do. I'd like to also thank all of our community partners. That was one of the strengths that came through in our visitor report about how engaged all our community partners were and how vested they were in the health. So thank you for coming. Have some cake.